Let's go on study. You have studied the pharmacological effects of chlorpromazine. It is based on the blockade of dopamine receptor, alpha, and serotonin even histamine 1 receptor. But the blockade of dopamine receptor is the main mechanism. So effects on the CNS are the basic effects for the therapeutic applications of chlorpromazine. So look at the disease include the first one is schizophrenia. Antipsychotic drugs are effective in eliminating delusions, hallucinations, anxiety, and manic episodes of schizophrenic patients. So here, it's mainly used to relieve the positive symptoms of schizophrenia. If the patient has onset of this schizophrenia, it is acute schizophrenia. It is more obvious. This effect is more obvious. In the treatment of type 2 symptoms, negative symptoms of schizophrenia, the first generation agents of antipsychotic drugs are not effective, even invalid, But in the treatment of type 1 schizophrenia, chlorpromazine is very effective, including some organic schizophrenia. But it couldn't cure thoroughly. It is necessary to use chlorpromazine for long-term, even whole life. But in the long-term therapy, this drug, because of so many pharmacological effects caused by chlorpromazine, it must induce many adverse reactions. The second therapeutic application is chlorpromazine can be used to prevent nausea and vomiting. If the emesis is caused by some drugs like morphine, cardiac glycosides, estrogen, tetracyclines, many drugs induce adverse effect of GI tract, including emesis. You will study these drugs. This emesis adverse effect is relatively common caused by them. So to control this emesis, chlorpromazine is effective. If some disease like uremia, cancer, radiation sickness, this disease also cause emesis. It's also relatively common symptoms in this disease. So this emesis, chlorpromazine also is effective, but it is not effective for motion sickness caused by vestibular stimulation. This emesis also it is related to dopamine receptor in the vomiting center. So that's why chlorpromazine is effective. And because of hiccup center is very close to the vomiting center, so chlorpromazine also has inhibition on this hiccup center. That's why it also used to treat refractory hiccup. Because of regulation on the body temperature, this chlorpromazine, because it also has effect on the body temperature regulation, so combined with physical hypoxemia, this drug can be used in hypoxemic anesthesia, like by using ice bag or ice bath, the body temperature can be decreased by chlorpromazine even to 30 Celsius degree. You know, during these conditions, the lower body temperature, the metabolism in the body is decreased. So BMR is decreased oxygen consumption. So it can help us to protect the brain and heart from ischemic injury during surgery. Actually, this hypothermic anesthesia. It is relatively commonly used in some complicated cardiovascular or cranial-cerebral surgery. You know, under the general anesthesia, accompanied with physical hypoxemia, to decrease the BMR, that conditions hypothermic anesthesia, it can improve tissue's tolerance to hypoxia and blocking blood flow. Next one, hibernation therapy. Hibernation therapy, chlorpromazine concurrently used with promethazine and pethidine are applied for artificial hibernation. You know, this drug can decrease the body temperature according to the environment temperature. It also requires physical cooling, such as ice bike or ice bath. And you know, this drug, chlorpromazine, also has potential action on the other depressive central nervous agents, central depressive agents like promethazine and pethidine. Promethazine, it is one histamine receptor antagonist. The first generation of histamine 1 receptor antagonists, they also have depressive effect on seeing eyes. To induce sleepiness is very common. And pethidine, this drug is similar to morphine. It also has a sedation effect on the seeing eyes. So when these drugs used in combination with chlorpromazine, their depressive effect on seeing eyes all can be enhanced by chlorpromazine. And with physical cooling, the body temperature of the patients decreased. So during this deep sleep, during deep sleep caused by these drugs, with the decreased body temperature, at these conditions, the body reduced BMR and decreased oxygen consumption. So the tissue resistance to hypoxia, or the conditions lack of energy, this ability is increased. So for the patients with some serious disease, like serious trauma, serious infectious shock, and even some ardent fever or central ardent fever or ardent fever convulsion, even thyroid gland crisis, this hibernation therapy is very important. It can help the doctor and nurse to gain time for other measures, even to find some etiological treatment. To save the patient's life, help the patients go through these serious conditions is very helpful. So this is artificial hibernation, also caused by hibernation therapy. And you know, it is not only use chlorpromazine. Usually, it requires a lytic cocktail, including chlorpromazine, promethazine, and pethidine. This is the common used agents for hibernation therapy. Try to remember this. Okay, what are the adverse effects of chlorpromazine? You know, in the treatment of schizophrenia, just now I mentioned, it often requires a long-term therapy, even whole life. And how about other antipsychotic drugs? Let's go on. You just studied therapeutic applications of chlorpromazine. It's mainly used for the treatment of schizophrenia, some MCs, and for the hypothermic anesthesia and artificial hibernation. And you know, for the hypothermic anesthesia and hibernation therapy, it just requires a transient uses of chlorpromazine. But sometimes, like anti-emetic action, it usually maybe requires a long therapy. But you know, in the treatment of schizophrenia, it always requires a long therapy. So this drug, chlorpromazine, it can block several different receptors in the CNS, even peripheral tissue. So it will induce many adverse reactions, including this. Okay, let's study one by one. Because this drug mainly block dopamine receptor in CNS, and you know, in the CNS, it includes several different dopamine pathways. The blockade of dopamine receptors in mesolimbic and the mesocortical pathway. This result is related to the clinical uses of the in treatment of psychosis. And the blockade of dopamine 2-like receptor in CTZ. It is the basic pharmacological effect of using chlorpromazine in the emesis caused by some drugs or disease. But you know, there are other also important dopaminergic pathway, substantial nigra and striatum. You know, this dopamine receptor, once it is blocked, it often causes an imbalance between the dopaminergic and cholinergic pathway. So, you know, remember, it decreased the cholinergic pathway function. So it will induce symptoms like PD. It is caused by extrapyramidal symptoms, EPIs. And the effects on tuberoinfundibular, this pathway, because of dopamine 2-like receptor in this pathway blocked by chlorpromazine. You know, this pathway is related to many hormones, endocrine hormones release. So it also induces adverse effect on endocrine system. Okay, so the more important is EPIs, extrapyramidal symptoms. You know, in the treatment of the schizophrenia, for some patients, it even requires whole life therapy. So these are more important. It includes 4 reactions. Now, based on the blockade of dopamine receptor in extrapyramidal nervous system, it often induces some reactions in early period. First one is PD syndrome. You know, the patient has some symptoms like PD, like muscular rigidity, tremor, you know, resting tremor, and mask-like facial expression. And this PD it's caused by chlorpromazine, occurs more in the elderly people. With the aging, the patients also maybe have degenerative disease of PD. So, and this sometimes maybe occurs within 1 month of using chlorpromazine. Some patients, maybe especially some young patients with schizophrenia after using chlorpromazine, maybe just several days later, the patients will show some symptoms of acute dystonia. Acute dystonia, it often means the patients have some uncoordinated movement of trunk or extremities. For example, spastic retrocollis. The patient's posture of head and neck, like this picture here. And torticollis. The patients will have some compulsive opening mouth, extended tongue. These are uncoordinated movement because this symptoms occurs in several days of using chlorpromazine. That's why it's caused by acute dystonia. This adverse effects occurs more in the young people than PD syndrome. Akathisia. Akathisia, it means the patients will show some symptoms like compulsive and involuntary restlessness. So for the patients with akathisia, it is difficult to sit there quietly. In the treatment of schizophrenia, once the symptoms of schizophrenia is abolished by chlorpromazine, but the patient has these symptoms of akathisia. Actually, at that conditions, the patients are very clear about these adverse reactions caused by chlorpromazine. So actually, at that conditions, it always reduces the patient's life quality. And these 3 EPIs, it is related to blockade of dopamine receptor by chlorpromazine. So chlorpromazine at these conditions, it induces imbalance between cholinergic pathway and dopaminergic pathway. Cholinergic pathway predominate because of this dopamine receptor blocked by chlorpromazine. So that's why the patients will show these adverse reactions. So similar to the treatment of PD, remember? Try to recover this balance between the dopaminergic pathway and the cholinergic pathway. Because here dopamine receptor is blocked by chlorpromazine. Some dopamine receptor agonists, they are invalid. So for the treatment of PD caused by chlorpromazine, don't use levodopa. You should choose anticholinergic drug like trihexyphenidyl. It is effective to control these EPIs. But some other patients maybe shows tardive dyskinesia. This symptoms is a late occurring syndrome of abnormal chloriform movement. This symptoms is irreversible. So once the patient has these adverse reactions, it often worsens the patient's life. Actually, no treatment are effective to control this tardive dyskinesia because it is caused by dopamine receptor sensitivity increased, or because of the long-term blockade of dopamine receptor by chlorpromazine, the body released more endogenous dopamine. It always may be related to these reactions of the body. So actually, it has no good measurement to control this tardive dyskinesia. Usually, even after withdrawal of chlorpromazine, the patients still have tardive dyskinesia because it is irreversible. So just to worsen the patient's life. And these 3 early period of EPIs, if we can use anticholinergic drug to treat, we also can decrease the dosage of chlorpromazine even withdraw. Maybe these adverse reactions maybe recover. But tardive dyskinesia, because it is irreversible, it still exists. Okay. Act on the seeing eyes. This drug, chlorpromazine, also induces some behavior effects in some patients in the treatment of schizophrenia. This is similar to some new psychosis. Behaviors effects include toxic psychosis. Actually, this psychosis is different from the primary disease of schizophrenia. If you are a doctor, try to distinguish the symptoms of them. And a few patients, after using chlorpromazine, maybe induce severe attack of epilepsy, even convulsion. Chlorpromazine also block alpha and beta receptor in the peripheral tissue. It has some adverse effects on ANIs. Because of alpha-1 blockade in the blood vessels, it induces vasodilation. So some patients has also studied hypotension. And because of M receptor blockade, chlorpromazine has anticholinergic effects. The patients will show some symptoms like dry mouth, tachycardia, blurred vision, even constipation in the GI tract. It also blocks dopamine receptor in the mammatrophic dopamine pathway. So maybe it induces some adverse effect on the endocrine system like hyperprolactinemia, gynecomastia, amenorrhea, glycotoria syndrome. Do you understand this? Yeah, it means pause of menstruation, but lactation. This is a syndrome. Yeah, and it also has effect on the male libido. Yeah, effects on the male libido may result from increased prolactin or from increased peripheral conversion of androgens to estrogens. And chlorpromazine in some patients may also induce some hypersensitivity. Once some patients has taken a large dose of chlorpromazine, maybe induce some acute toxicity of chlorpromazine. So at that conditions, try to take some symptomatic treatment, including, to correct hypotension caused by chlorpromazine by using norepinephrine. Okay. Just now you finished the study of chlorpromazine. It worked as the representative drug of first-generation antipsychotic drugs. Actually, there are many agents of first-generation antipsychotic drugs. And now there are also some other second-generation antipsychotic drugs. They also called by atypical antipsychotic drugs like clozapine and risperidone. They can selectively inhibit dopamine 4 receptor and serotonin receptors, having lower risk of extrapyramidal reactions. Especially this clozapine can selectively inhibit dopamine 4 receptor. This dopamine 4 receptor mainly locates in mesolimbic and mesocortical pathway. Risperidone, it is more potent than clozapine. In the treatment of negative, type 2 schizophrenia, the first generation antipsychotic drugs usually are invalid, but this clozapine and risperidone, they are also effective for the negative symptoms of schizophrenia. Sulpirate. This drug selectively inhibits dopamine 2 receptor in the mesolimbic and mesocortical areas of the brain, producing lower extrapyramidal adverse reactions compared with chlorpromazine. Okay, this slide introduces some supplemental knowledge of antipsychotic drugs. Drug selection. Second-generation agents like risperidone are generally used as a first-line therapy for schizophrenia because they have relatively less, very low risk of eliminating EPS associated with the first-generation drugs. Approximately 10% to 20% of patients with schizophrenia have an insufficient response to all first and other second-generation antipsychotics. And only clozapine, maybe it is effective to control the respiratory schizophrenia. And this drug has a minimal risk of EPIs. However, its clinical use is limited to refractory patients because of serious adverse effects. It has adverse effect on about, full bone marrow suppression, even induced seizures, also systolic hypotension. Because of this adverse effect, its clinical use is limited. Just the yearly use for refractory patients. You have studied the antipsychotic drugs. To help you to understand this disease and the drugs, I have two cases to you to analyze. First one, a 24-year-old man employed as a policeman locks himself in an interrogation room, waving his handgun and yelling incoherent statements such as, "They aren't going to take me alive," and "Get off my head." His partner tells the policeman chief that the man has been acting strangely, talking about a conspiracy against him by the other policemen, and arriving for work in dirty clothes and unshaven. He was overheard talking and arguing with himself in the locker room that morning, and the partner says they almost got into a fight just minutes ago because the partner wouldn't agree to shoot him when he instated that he wouldn't be hurt and was immortal. A medical emergency team arrives on the scene, and at a moment when he is sitting in the corner, cowering in fear, they forcibly enter the room, disarm him, and inject haloperidol into his side. He is transported to the locked ward of a psychiatric hospital and diagnosed with paranoid schizophrenia. Yeah, paranoid schizophrenia. It is just one form of schizophrenia. Now, let's look at the discussion. Actually, schizophrenia affects about 1 in 100 males and can be one of the most dangerous of all mental disorders, as it causes those it affects to lose touch with reality. They often show signs of confusion, inability to make decisions, auditory hallucinations, delusions, neglect of personal hygiene, strange statements or behavior, and changes in eating or sleeping habits, energy level, or weight. In the paranoid form of this disorder, schizophrenics develop delusions of persecution or personal grandeur. Personal grandeur. The first sign of paranoid schizophrenia usually surfaces at ages 15 to 30. The schizophrenia is much more common in males than females. There is no cure, but the disorder can be controlled with antipsychotic medications such as haloperidol. Haloperidol is a good choice for acute psychotic episodes, as it is rapidly absorbed and has a high bioavailability after intramuscular injection, with plasma levels reaching their maximum within 20 minutes after injection. Actually, this agent, it is one of butyrophenones. It also is the first generation antipsychotic. Another case, actually for you, it is a question to answer. Chlorpromazine has been prescribed for a patient with schizophrenia, and the patient has been taking the drug at usually effective doses for about 6 months. Today, he comes to the hospital with other medical conditions that will require surgery and the administration of other drugs. And we decided it is unwise to stop the chlorpromazine and run risk of psychotic behavior while we perform other intervention. What other signs or symptoms that the patients may also have or acquire as the result of surgery and drug therapy are mostly likely to be affected beneficially by the continued use of chlorpromazine? Now, this is the background of this question. And the question is, what other signs or symptoms are most likely to be affected beneficially by the continued use of chlorpromazine? Remember, chlorpromazine, it is one agent of the first generation of phencyclidines. It is the prototype drug in phencyclidines. It is also indicated for managing nausea and vomiting in both adults and children from a number of causes, including some disease or drugs. The drug can be administered orally, rectally, or intramuscularly for this very purpose. And some phenocyanidins with major antiemetic activity, such as prochlorperazine and promethazine, are usually used inside. Regardless, the antiemetic mechanisms appears to involve blockade of dopaminergic receptors in the chemoreceptor trigger zone of the brain's medulla. So here, the answer should be C, nausea and vomiting. The other signs, epilepsy and the risk of seizures, hypotension, urinary retention caused by abdominal surgery, dry mouth caused by antimuscarinic drugs used to prevent intraoperative bradycardia. These may be some adverse effects caused by continual use of chlorpromazine. Understand? They are not be affected beneficially. Try to understand the question. But notice, in general, phenocyanidins are not used often for managing emesis or nausea. That is in part because of the risk of excessive sedation, extrapyramidal actions, orthostatic hypotension, and occasional cholestatic jaundice. Nowadays, we tend to turn to other dopamine antagonists, like metoclopramide. You will study, when you study the drugs for GI tract, you will study this agent. Cannabinoid or serotonin receptor blockers. Okay, till now, you finished to study antipsychotic drugs, especially chlorpromazine. It is the representative drug. Its pharmacological effects, including the mechanism of its action and the therapeutic applications and adverse reactions, especially EPS. All this knowledge are more important for you. So here, maybe you want to know what drugs can be used to treat mania. Go to study next section. I will teach you.